Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
What is that?
Just something new.
Clacking. Okay, Brad, today we're going to talk about tendonitis. Doesn't matter where you have it. If you have tendonitis anywhere in your body, we have this specific massage, a special massage, that's going to help you take away the pain. So this is something you can do yourself. Just make sure that you do it correctly.
Right. And again, there's a time frame when you can do it and when you can't do it, and we'll talk about that too.
Sounds good. By the way, if you are new to our channel, please take a second.
Yeah, we did have someone looking in out there.
Yeah, we did. Please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
There you go.
Also, head over onto Facebook and like us there. Brad and I are deep into our therapy right now, and we're just getting to that point where we're starting to accept ourselves. So if you accept us too, it'll move us along quicker.
So like us, is that what you're saying?
Yeah, like us.
On the Facebook.
On the Facebook. Okay. So this massage is something we've shown in some of our other videos. It was developed by Cyriax, Dr. Cyriax, who is considered the father of orthopedic medicine. Man who was way ahead of his time. And, I can tell this massage has helped me specifically with certain problems I've had as far as tendonitis.
Oh, me too. And as far as our patients as well, but I think we get more comments saying this really helped them out than other, a lot of our other advice. So it's
cross fiber friction massage, or sometimes it's called deep friction.
Now listen close, because there's some things that you have to do and pay attention to make it work, and some red flags. So we want to
wake up out there, pay attention.
Exactly.
All right, so this cross fiber, let's first talk about what it does. It enhances the blood supply to the area.
Right.
But probably the biggest thing it does, it frees up adhesions or scar tissue.
Sure.
And that scar tissue is quite often the source of your pain, believe it or not. It also stimulates the mechanoreceptors. You don't need to know.
Yeah, we don't want to get into all the details.
When should you not do it? Let's talk about that first. If you have like a bacterial infection, which is pretty rare, I mean, you wouldn't want to do it. If you have rheumatoid arthritis, if you have, if you're trying to rub over a nerve, that never helps.
Right, that's going to be uncomfortable.
If you have bursitis, if you're diagnosed with bursitis, which is different than tendonitis, it wouldn't be good. And if you're starting to get some ossification, or the growth of bone into the tendon.
Sure.
Sometimes you'll have an x-ray and they'll say there's...
Like a bone spur.
A bone spur, yeah. Then if you're doing a bone spur and you're trying to rub that tendon, it's not going to help.
Right,
So generally what happens when you're getting a tendonitis, like for example, let's say the shoulder, supraspinatus, that's the muscle up here, most common tendonitis to happen in the shoulder. And it gets in here, it's getting pinched, and we've talked about this before, but it creates scar tissue after a while.
Sure.
The tendon gets roughened up and it starts to heal, and it heals in an erratic fashion.
If you imagine a rope, because a tendon oftentimes are like a rope, like a tendon always at the end of a muscle, which connects to the bone. It's that junction there that connects the muscle to the bone. And if you have to take a rope and you rub it across a corner, after a while that rope starts to fray. And those frayed materials need to start to come back together. And I think that's what we have this is a good segue into our masterpiece of art.
Yeah, wow, isn't this something?
So this
Can you see the line? Is there any no
reflection?
glare or anything like that?
This represents a tendon like here to the bone and the muscle bit here, and this is a tendon blown up, so you can see those fibers that we talked about, that rope, they're trying to heal together, but they're all mishmashed up and they're not very strong this way.
I've heard you call it like a cobweb, Brad.
Yeah.
I thought that was a good indicator.
Exactly. Now, after the massage and then you exercise it, you can see how the fibers become all in line, and when the tendon pulls, this is strong. Going to make it strong and do everything it's supposed to do, unlike when it's healing up in this quagmire of mass.
Yeah, and this is going to give you pain. It pulls on there, you get the pulling here and the pulling here, and it pulls in all directions, and it pulls on the tissues.
And you could actually start to get a fissure in there and another tear.
Yeah. Scar tissue is weaker than regular tissue.
Right.
So you want to make it stronger.
Right. We want to get it in line so the scar tissue becomes strong, and and maybe even stronger than before.
I know we've taken a long time to describe this initial part, but it's really important.
They want to see the technique.
Yeah, they want to see the technique. Let me just give you one example of where it helped me, Brad, and we'll go right to the shoulder.
Sure.
I was having shoulder pain. I was a brand new student. I just came out. I was a brand new employee of physical therapy. Just came out of physical therapy school, having shoulder pain, doing all the things, ultrasound, ice, just was not getting better.
Right.
And I did this cross fiber massage to the shoulder.
Right.
2 days, it was gone.
Okay.
Just gone. I mean,
Excellent.
So what's nice about it, okay, the supraspinatus tendon, all these massages, you're going to go across the tendon and you're going very deep, and you're I don't know if you want to go a little closer up here, Lonnie, but you're going to go across the tendon and you're really pushing down deep to get into the tissues.
Right.
So for the supraspinatus, which again is the more common one in the shoulder, you put your hand back behind like this, and then there's a little gap in here. May be a little hard to find for the layperson. Find the tender spot generally is often what.
Right. Yep.
And you get that. I usually put one finger over top of the other one,
Yep.
and I rub like this. And like I said, I get pretty aggressive on it.
So he's pushing down in through the skin into that tendon.
Yeah. If you become kind of experienced at this, after a while, I can actually feel the rough spots.
Sure.
I mean, as I start going in further and further. So, give this a try for if you have a shoulder tendonitis. There's also the bicep tendonitis, where that one, you actually keep the arm out straight like this, and there's kind of a little groove right in here.
Right. The upper.
And then you hit that groove, and that would get the bicep tendonitis then.
Right. And the thing is, when you start doing this, you're going to get in deep. It's going to be uncomfortable at first. When I do this to myself or to a patient in the clinic, I look at a second hand on the wall or whatever, digital, and I go between 30 and 60 seconds, and if it's not feeling better or a numbish feeling, and it's actually getting worse, then I stop. It's not ready for it
Yeah,
yet.
if it's neutral, I probably still keep going.
Sure.
If it's getting worse, we stop. And then
Right.
we ice, and you do ibuprofen, you do all those things to help calm it down some more.
Right. And
You
then
know,
you can come back to it.
Yeah, it's usually, this isn't something you're going to do day one on an injury.
Right.
This is something that's been, maybe after 3-4 days.
Right.
It's a good thing to start.
Sure.
And so that's the supraspinatus. You're going to go right here. That's the bicep, and you're doing it in the groove right there. Let's go into down here, Brad.
Sure,
How about
to the elbow.
Yeah. Let's go golfer's elbow. That's the elbow, when the muscles that attach into the medial
Yep.
bone right here, medial epicondyle.
Yep, right there. You can always, that bone sticks right out pretty good.
So I go right off the bone, not on the bone, and right there. That's usually the spot.
You'll feel the tender spot.
Yeah, I have a little tenderness there.
When I do this one, I myself, I use my thumb just because I can grab
Sure.
a hold of my olecranon or the elbow
Oh,
bone.
that is good. That
Yeah,
does work
you
good.
get some force there. You get a sore thumb. Then that's how you know how long to do it. Because Syriac says up to 20 minutes.
Syriac says, I was looking up on all these, and he's always a little bit different, like 15 to 20 minutes
Yeah.
a lot of times, and a lot of them are every other day. What I tend to do, this is just my method, I tend to have, like, I'll do a couple minutes here, I'll do a couple minutes there.
Right.
I might do it a couple times a day even.
Because if you're
Yeah.
doing this one or this one for about 2 minutes, your thumb or your fingers, they get
Yeah.
pretty darn sore.
Yeah, it's really hard to believe you'd be able to do it for 15 minutes. I mean, I can't even imagine doing it on a patient.
You got to be pretty tough.
But it's interesting, when he talks about his guidelines, like the supraspinatus, he said, 15 minutes 2 times a week, but that could last 2 to 6 weeks.
Sure.
The bicep apparently tends to respond better.
Okay.
The bicep, that tends to go like 2 to 3 weeks.
Right.
So let's go on to the golfer's elbow. He says usually 6 to 12 sessions, so that may be a little more stubborn one than the.
Sure. Right. And you'll know.
You'll know.
Right.
And generally, my experience with it, it starts to get better right away almost.
Right. You'll know it the
Yeah.
next day. It's like, oh boy, that did help.
That did
so
help.
you do it
right.
again.
It may not feel better that day, but the next day after. You can try tennis elbow too. Same thing, going to go off, and you're going to rub, putting the one finger on top of the other. A lot of times you need to do other things with the tennis elbow, which we've done a video on, but
Right.
it's a good start.
Right. So this is one of the few treatments that involve with the tennis elbow, along with all these, because we have videos pretty much in every part of the body.
Yeah, that's exactly right. We'll go right down the body. Let's talk about, how about underneath the patella, Brad?
The infrapatellar tendon.
Yeah. So you got your kneecap here, and then you got right here, you got a tendon. And I think a lot of times they call that jumper's tendonitis.
Jumper's knee?
Jumper's knee, yeah.
Right.
So again, you're just going to go right, and you could. Ideally, you want to be relaxed when you're doing this, Brad.
Yeah, exactly.
Now I know with Cyriax, he actually even pushes up like this. He pushes the knee. He'll push on the top part of the kneecap.
To get slack on there?
Yeah, to get slack on there, and then he'll go like this.
Sure, yeah.
If you even get like this, though, you're going to be pretty close.
As long as you keep your quadriceps loose, because this tendon here is nothing more than part of the quadricep tendon. The quads go to the kneecap, then the kneecap jumps over here, so it's all part of the quadriceps.
So again, if you want to see exactly what I'm doing, I'm taking the thumb and I'm pushing the kneecap like a teeter-totter.
Sure.
I'm pushing up on the one side, and then I'm rubbing on the other side with it
Right,
like this.
right.
It does really get the tendon that way, Brad.
Yeah, sure.
It is better than this.
Yep.
It is more
To get that-
specific. Yeah. And same thing, you can do it a bunch of times a day when you're, sitting idly at your desk or whatever. You can stick your foot out
See
there
what the
and
boss says about that.
see what people are talking about.
The one that I've had good success is the Achilles
tendon?
tendonitis. Yep.
Sure.
Where you do. You've got
Okay.
you got the shoes that slide off. Plus you got those gargoyle socks. That people just love those. Look at those socks, huh?
Argyle socks.
Yeah. Oh, now
Brad
he's
is
taking them
mystique.
off.
I'm going to take them off. So now the thing with Achilles tendonitis, it generally is not on the back, the scarring.
Sure.
It is on the side.
Yeah.
So you're going to want to go on each side of the tendon like this. And I have found that to be true in my case, that's where it's sore.
So he's kind of pinching
So I'm
around
pinching,
it.
yeah.
I don't know, like this, if you can see that. Here, and you get around to the back side of the tendon, and you're going to get sore fingers on that. But
Yeah.
I'm telling you, I had a case of tendonitis, and my running was going downhill, and this was very effective.
Yeah. It's in not rare cases, in some cases it's actually in the front of the tendon, Brad, and you have to
Ooh.
push it over and rub on it in there.
Yeah, you got
That's
to
kind of
get in
yeah.
around that tendon.
a little more tough to
Because
do.
it's such a massive
Yeah, a
tendon.
big
It's
tendon,
probably
yeah.
the biggest tendon in your body.
And I find it's funny. That tendon is sore right now.
Oh, really?
I mean, yeah. It's. I don't feel it running, but I'll bet you I'm kind of pre-pain.
Yeah,
You know what I mean? It's
sure.
and that's usually the case is when you find something that's tender when you touch it. Eventually, over time, it may end up being you're going to have
Working,
pain
right.
when you're just walking or running.
Sure.
So.
A lot of runners get that, long distance runners.
Yeah, they do.
Exactly.
All right.
Well, Bob,
so those
what
are
do
the
you-
magical massage.
Yeah, exactly. So what say you, Bob?
I say let's have everybody subscribe to us so we can go up to the number million. We want to shoot for 1 million subscribers, Brad.
Exactly.
We're hitting close to 300,000 right now.
Yeah, exactly. 10,000 more, and that'll come in the next week or so. But one way or another, work on that tendonitis.
That's right.
Be
Thanks a lot.
careful.